Actually, I was active in Campus Crusade when I was here and went overseas to the Philippines between undergrad and grad, and really wrestled with, should I continue this process of, I think I'll end up moving over here, should I continue this process of going on with medicine, or should I stay working overseas, because there's so much you can do without medicine, and in fact so much of what needs to be done does not necessarily require high-tech training in this country. But I felt like God was calling me back to continue my education, or to finish it, and but I was really touched by the idea of serving the poor with healthcare, and that's, I think, my experience, both my own experience growing up in actually absolute wealth, but as a poor person in Chicago. I mean, it really is amazing. You go work in Africa, you come back and you think, oh my gosh, you know, there weren't really that many times that our family went without food, a handful, but nothing like what you see in Africa. So that's where I got inspired to go and do healthcare for the poor, and it struck me that the best way to do that was to focus on public health. And so I did a master's in public health while doing my MD downtown, and got interested in infectious diseases because those were the diseases that were affecting people in developing countries, things like malaria, tuberculosis. And so I continued my training in that one, worked at the Centers for Disease Control, where I worked in parasitology, and worked in South America, particularly in Bolivia, and then after that came back to Chicago to work at Lawndale Christian Health Center, where I helped set up an HIV program and a tuberculosis program. And from there, worked with the TV program for the city, and then now I moved over to Rush University, and that's sort of a whole different thing that's been a learning curve for me, is how do you be a Christian in an academic world. It was actually easy to be a Christian at Lawndale Christian Health Center because it was right on this sign, and so you knew what you were supposed to do, to be a Christian and witness to God. But then when you went into the academic world, the question that I always wrestle with still is how do I look like a Christian in that world as opposed to my current world. I'm not sure you can check so yeah, I think what I'll do is then explain a little bit more. So 20 years ago, Ron Sider wrote the first Rich Christians in an Age of Hunger, which I read. So I was here on campus. Actually, it's coming up on 28 years. So it's been a while. My kids are 18, 15, 13, and 10. And that moved me too, and I thought about how to utilize it. My wife and I expected us to be overseas. We met through something called Christian Community Health Fellowship, which is an organization of people interested in healthcare to the poor in this country. And what we noticed when we started working in inner city here was that there was even greater need overseas. My wife had grown up in Egypt, and so she was familiar with the poverty of Egypt. And so basically, we felt called overseas. Our oldest daughter developed cerebral palsy, had cerebral palsy, and developed some other learning disabilities. So we felt we needed to stay and take care of her health needs, which is what has kept us here. So that's what redirected us. So what I cover in the topic, which I can do with or without slides, is some of the stuff that you got a little snippet of the video with, and that is that in the world, in the U.S., we have incredible wealth. And what's really amazing to me is that we don't even appreciate it. About $240, $250 billion a year is spent on the U.S. in advertising, and about $440 billion worldwide. And what advertising is all about is creating the illusion of need. It's really it's a world of discontent. So why do we do ads? The ads are there to help you walk away and say, you know, I kind of need that bike, or I need that computer, or my computer's not good enough, or my projector doesn't work. So advertising creates this discontent, which actually, my personal view is that that's pretty anti-Christian, because our whole gospel is a gospel of being content with who we are and who we are with God. So the whole world of advertising and the way our system is driven is probably anti-Christ in a way. I mean, it's not the anti-Christ, but it is anti-Christian. So into that world enters this idea that there's hundreds of millions of people who are starving, and yet we're walking around this country. I wonder, we're walking around this country thinking we need more. So the stats are out there. The statistics on what our needs are pretty compelling and pretty scary. We spend about $40 billion a year in the U.S. on diets. spend about an additional $40 billion a year on alternative medicine, herbs, vitamins, those kinds of things. If you took those two amounts and spent them on vaccines, clean water, and rudimentary nutrition, you could actually alleviate all malnutrition in the world, which is about 700 to 800 million people who go to bed each day with malnourishment. You can vaccinate all children in the world. So we have this incredible wealth here that is really misused. And obviously, it's not like we can all wake up tomorrow and people are going to stop doing that and shift, but I think as Christians, we can be incredibly countercultural. I think early in the Christian church, one of the things that was really kind of neat to me about the early church is that Christians stood out as countercultural. One of the things that converted the Roman Empire was that this group of sort of crazy people came along who did things that were different. So what did they do that was different? Well, one of the things they did is they started rescuing the babies that were abandoned outside cities, because in the Roman days, if you didn't want your child, you had up to the age of 1 year to decide, and you could abandon them. And most often it was little girls. So the Christians started taking in these kids, and they started taking care of the lepers and taking care of the starving in those areas. And actually one of the early Roman emperors commented that this was so profound that Christians had found such good favor with all peoples that they couldn't squelch this movement. So I think what set them apart early on was this idea. I actually don't think it was their connection with God. And in fact, I was thinking about this in a way to say it gently. I'm preaching Sunday on worship at Evanshire Presbyterian in Skokie. One of the things that I've learned recently is that our worship of God, like the music and the things that we think of as worship, is really not it. I mean, what our worship of God is what we do with our lives and if we point people to God. So all of these thoughts are swirling in my head, and I think what I would encourage you all to think about is how is my life going to look so different that if I'm a university professor, the other professor can say, man, there's something really radical about this person. Maybe that radicalness is the simple way in which you live your life, what you do for the poor. So what I do at Rush right now is I spend 1 to 2 months a year right now, is hopefully more, working on projects in Africa, as well as trying to support the inner city. And what we do in Africa, it started out as an actual research project. So we noticed that, so you've seen the horrible statistics, life expectancy is 37 years, 38 years. What drives those bad statistics is that so many children die before they reach their 5th birthday. And in fact, in sub-Saharan Africa, about 20 to 30% of children die before they reach their 5th birthday. And those of you who are mathematicians know that that's going to drive down life expectancy, because life expectancy is just an average length of life divided by the number of persons born. So if you really want to impact people's well-being in a developing country, you would work on children. So we knew that 20% of all children deaths in Africa are caused by pneumonia. So kids get a bacterial pneumonia, they get really sick, and they actually they die from that pneumonia. In this country, of course, any of you who have been in healthcare or have parents who are doctors know that nobody really dies of pneumonia, certainly no children. We just treat them. So why do they die of pneumonia in developing countries? Well, the main thing is that they don't get access to antibiotics and to get treated. There are other reasons like malnutrition and lack of vaccines. Years ago, people had studied and learned that if you diagnose pneumonia right away in kids and start antibiotics, things go well. And so the whole idea in these research studies was that they can train field workers, not even doctors or nurses, to take kids who have a rapid respiratory rate, a cough, and a fever, and they could just make the diagnosis of pneumonia without chest x-rays. Have you killed it again? It's amazing. And so, so you can teach, I can teach anybody here, if you were attentive enough, in about 15 minutes how to diagnose pneumonia with really good accuracy. Then I can give you a bag of 3 different antibiotics, and based on how sick they are, based on really simple things like how fast they breathe, and whether or not they are having trouble by drawing in their chest as they breathe, you can diagnose, viral syndrome, pneumonia, or severe pneumonia, and give them these drugs. And the study